Good afternoon. My name is Jim Weatherup. I'm the chairman of the Oswego County Legislature. Joining me today are Dr. Christina Lipke, Oswego County Health Department Medical Director, Dr. Dwayne Tull, Chief Medical Officer for Oswego Hospital, Jen Chang Wang, Oswego County Public Health Director, Jody Martin, Supervising Public Health Nurse of Preventative Services, Tina Bourgeois, Senior LPN, and Diane Oldenburg, Senior Public Health Director, along with Phil Church, County Administrator. Thank you for participating today. We were notified by the New York State Health Department this afternoon that 2 Oswego County residents have tested positive for coronavirus. Both individuals were tested on March 18th and have been in precautionary quarantine in their homes and are recovering. One individual was tested at Upstate and the other at Oswego Health mobile testing site at Oswego Hospital. The 2 cases are not believed to be related. Both individuals are between 20 and 40 years old. This further demonstrates that all ages are at risk. Both had recently returned from international and domestic travel. The County Health Department is working closely with the New York State Department of Health to identify contacts of the infected patients. We wish our residents a full recovery. Our county departments and our community partners have been working together for several weeks to prepare for the probability that coronavirus would spread to Oswego County. The most important things that people can do are to wash their hands frequently, follow personal preventative measures, and practice social distancing. This is especially important for at-risk groups such as senior citizens, people with compromised immune systems, and people with underlying medical conditions. At this time, I would turn it over to Dr. Christina Lipke.
Thank you, Mr. Weatherup, and thank you to Dr. Tull for joining us again today. Again, the news that Oswego County has its first case of COVID-19 understandably is scary to hear. It is important to remember that influenza and other viral illnesses are more common at this point still. If you are sick with respiratory symptoms that are mild, it is safe and advisable to stay at home so that you can get the rest you need and not spread any illness. Naturally, people will want to know if they should be tested for COVID-19. If you have traveled to areas where it is prevalent or have had close contact with a person who has had COVID-19 and you have a fever or a cough, then you should call your doctor. If you do not have a doctor and this applies to you, then call the County Health Department's COVID hotline at 315-349-3330. Again, remember that the Health Department is working with the New York State Department of Health to identify and notify the contacts of these cases. Next, I would like to introduce Diane Oldenburg, Senior Public Health Educator at our Oswego County Health Department.
Thank you, Dr. Lipke. At this time, as of 4 o'clock today, just wanted to review some of the numbers that we have as far as residents tested. So again, as of today at 4 o'clock, we've had 104 people that have been tested or scheduled an appointment to be tested. We have 64 people that are being monitored in precautionary quarantine. We have 5 residents now that are being monitored under mandatory isolation or quarantine, and we have received 2 positive test results to date and 50 negative test results to date. I would like to next introduce Dr. Tull, the Chief Medical Officer for Oswego Health.
Thanks, Diane. Unfortunately, we all knew that this day would come, but I can honestly say I'm very confident in our county as a system, as well as Oswego Health. For the past few weeks, we've been training our staff, cross-training positions to try and cover the probability that the coronavirus would impact Oswego County. Oswego Health will do everything we can to support the community, our employees, and the county in any way. A few things we need to remember. This is a virus that will affect all ages. You are not exempt if you're going on spring break. We need to pay attention no matter what your age is. Most important things are social distancing, good hand hygiene, avoiding your face. The other thing we have to remember, 85% of the people that get this virus should be able to be treated at home and will not need a hospital or an urgent care or emergency room. Please do not overrun the emergency room or the urgent cares. Call your primary care physicians or call the health department for information before you show up in any of these locations. We had a question come in online about why it takes days to get our tests back. We take the test, they are then immediately sent to the testing lab, and unfortunately the test can take anywhere from 3 to 7 days according to the volume of tests that they're doing at the lab and the processing. As soon as we get results, we release them back to the county. The county does the same with us for tests done out of the area, and we're working together to try and get all of this done. Back to Jim.
Thank you. We realize that this is a challenging time for all of us. I ask you to please follow the protective guidelines that we've been sharing, and please refer to credible sources of information, including the County Health Department website at health.oswegocounty.com/COVID-19 or call the Oswego County COVID-19 hotline at 315-349-3330. Thank you.